I am Dr. Leo Alfonso Pascua. My nickname is Leo. I took up sports science as pre-med and course in college. Currently, I am a first-year radiology resident. So why radiology? Honestly, not strongly considered it as first choice. Either rehab or radiology. I actually took rehab medicine prior. Essentially, I had the opportunity to apply to rehab medicine later on due to my background as reservist sa military, but tried out radiology since I saw the opportunity outside the usual hospital work, like diagnostics, software. With that, it's also a niche in a way since it's a unique specialty, especially correlating clinical with pattern recognition and reasoning through imaging. We actually play a big role in the management of the patient and support to the clinician. So 3 words to describe residency: commitment, humbling, and hands-on, especially in my training institution. Sabi nila chill daw. But there are a lot of nuances in the training program. But in my case, we are focused mostly in X-ray and fluoroscopy special procedures such as esophagogram, small bowel series, barium enema, fistulogram, hysterogram, upper GI series, small intestine series, cholangiogram, voiding urethrogram, and a lot more. Medyo overwhelming siya, so it's not chill pala. Later within the year, actually currently on my 5th to 6th month, we are now expected to man the ultrasound and handle ER calls for it, aside from the outpatient, inpatient, and ER X-ray studies during duty. So last night we had 3 ER ultrasound studies aside from the usual X-ray studies we had. So already in our 5th to 6th month, as I said, we also took note of our census, and nakita ko shockingly, personally I had 2,800 X-rays initial read na. So it's a bit hefty, but we're also trained to be quick in analyzing our studies since nakakaya if the consultant mauna pa sa'yo sa especially ER studies. But duty-wise naman, not as physically taxing as ward-centric departments such as IM, surgery, or OB, but definitely mentally draining and tiring pa rin due to the volume of studies we have to analyze and initial read. Then during your duty, sometimes you're focused on a certain study, then may magpapa-initial, minsan consultant, so surprise na lang. In my institution, weekday duty is 16 hours, so 4 p.m. to 8 a.m. Then weekend duty is skeletal, so 24 hours, 8 a.m. to the next day, 8 a.m. So, currently, the hardest part so far is adjustment since in my previous med school we don't have a focused radiology subject. And in my pre-med and initial pre-residency program, we focus on rounds and clinical work. And some med schools, they have a focused radiology program, so at least they have a technical advantage if they would apply to residency as first year. And nakakabigla siya since you have to be a jack of all trades, from anatomy, physiology, correlating with the clinical presentation and history of the patient and physical exam. So for example, in Parkinson's and Alzheimer's, both present with dementia, but in Parkinson's, there is also a motor deficiency. So you have to know the protocol if you're gonna do a brain scan. So in that case, it's also rewarding kasi we're trained to be clinical radiologists. So, magamit ko siya if I plan to pursue my previous field in sports science, and if I want to extend more training sa rehab MSK, magamit ko yung correlating imaging-based to evidence-based medicine. So my advice to newly board passers and currently if you're in med school is to be self-aware. Don't go to residency just because. It takes commitment, time, and effort. Imagine 4 years, minsan 5 years, to do residency. So it takes a lot of energy out of you. And early on, if you're in med school, assess the pros and cons and different learning dynamics of a certain department. So you already have a broad perspective if you plan to do residency once you pass the board exam. And rest is part of being productive. Don't get too pressured that residency lang yung path. To be honest, one of the reasons I chose radiology is outside medicine. The technology. It's important also to be technically savvy and knowledgeable regarding the modality, since you have to know the indications of a modality if you're gonna put it up on a certain area. Know your strengths and weaknesses, since if you focus on the usual no 24-hour duties or the work-life balance, those benefits, you might miss out on important aspects such as integrating your own learning dynamics and adjustment to a training program. But it's possible also your learning skills and work dynamics doesn't fit the program, so you might get burnt out and eventually might falter and quit. So sayang naman. So I hope you consider to take radiology if you're moonlighting, and if you're in med school, consider this specialty and research more about it.